Now to Niger State, where the state government has confirmed the kidnap of the State Commissioner for Information, Mohammed Sani Idris. The commissioner was said to have been kidnapped by bandits at about 1 o'clock in the early hours of Monday from his home at Babantunga village in Tafa local government of the state. Now the resident, all right. Moving on to other stories now, the resident doctor strike has entered its 8th day. The House of Representatives Committee on Health Services has now intervened in the face-off between the federal government and National Association of Resident Doctors in order to end the industrial action. At the meeting brokered by the committee, its chairman, Tanka Sununu, appealed to all parties to prioritize the health of the poor masses who patronize government-owned hospitals. The meeting was attended by the Ministry of Health, the Budget Office, leadership of the resident doctors, chief medical directors of government-owned hospitals, among other key actors. At the end of the meeting, which lasted over 5 hours, a team was set up, a subcommittee, to meet on Tuesday and iron out all areas of disagreement between the government and the resident doctors. The National Association of Resident Doctors last Monday resumed its suspended nationwide strike over allegations that the government did not keep to its side of the Memorandum of Action, which led to the suspension of the industrial action in May. The doctors say there is no going back this time around until all their demands are met.
If there is accusation of forging signatures, if there is fact that nomenclatures are introduced, if there is fact that both parties are arguing here and there, it becomes a very serious issue. But nevertheless, we have identified problem. People are recruited. The process wasn't followed in some aspects. That has affected the service delivery. And we are in a situation whereby service has been interrupted.
This is the second time we are going on a strike in this year. Not 3 times, not twice. The first one was on the 1st of April, called off on the 10th. The second one was started on the 2nd of August. Why are we having these bottlenecks? Because some people are not doing their jobs. This is settled.
So please, I'm appealing to you to see how we can continue this dialogue, and I'm appealing to our colleagues in NARD. You can't, we have had about 3 strike actions within the space of 1 year or 6 months. It doesn't do any good to the image of doctors. That is the truth. It doesn't.